Well, I think the main shifts in healthcare at present are a couple of. First of all, there's now technology that's able to touch because it does work. It gets into the marketplace, you can buy it. Second of all, you now see that there's science that backs up some of these aspects and also technology. Maybe not all of them, but that's work in process. The third thing that's happening is that also healthcare insurance companies are starting to buy these kind of programs and also to reimburse that. And I think the fourth part of it is that patients, family and informal care are actually demanding to get into a healthcare delivery system that works like all other things that they face in society, like banking and buying stuff and your insurance companies. So I think those would be some of the drivers. How could healthcare get ready for this transformation? Well, first of all, the question would be, is healthcare ready already? And I don't think so. I think there's a lot of neglect still that these kind of developments would happen in another phase or in 10 years from now. And the reality is that it's started to kick in right now. Although it's not a linear process, it takes a while before it gets up and running, and then all of a sudden it moves like exponential into it. So healthcare has to be prepared in a couple of ways. First of all, we have to educate people. That should be done in the initial phase. So once we start to train physicians and start to train nurses, the technology should be in there in the curricula for these people right from the get-go. Afterwards, for people that are in the workforce already, we should train in terms of master classes and continuously medical education, of course, as well. But also to get their feet wet. Just go into practice, make sure that you figure out and work with these kind of technology and processes, because often it's also fun to do it, because it can really also help to reduce some of the burden that you're facing. Like in the Netherlands, 40%, that's 40, of our healthcare colleagues have an administrative burden on an everyday fashion. So I think it's both at the initial phase and in the phase that during implementation and continuously medical education, it needs to fit. I should answer by now that it's new players. New companies that are not traditionally have worked in healthcare yet, now starting to embark on this new sector for them, and they will approach it from the health aspect, so not from the medicine aspect, but from the health aspect. And gradually those two will crawl towards each other in terms of a blended kind of way. So the Apples of the world that clearly have an ambition to take a foot between the door in this health aspect, also on a data level. I think in the end of the day, looking back 10 years from now, I would say that that was like the pivotal moment when other players started to embark on this, that it pushes healthcare sector to get things done. So I think these new companies that are arising in this healthcare market, like Apple and Google and other ones, is both a threat and an opportunity. Let's be honest, in the Middle Ages we had crooks, and we will definitely also have crooks in the future, but there's also all kinds of opportunities in it. If the technology and the way of working and the way also that they market their products could be used in healthcare, well, let's imagine that we could change the healthcare of people first, the lifestyle of people, and thus also healthcare. So we have to pay attention. We may have to make sure that policies and laws prohibit that wrongdoing is going to be done. But other than that, I think we have to balance it. Also have be related to ethical questions.